Absolutely. Thank you, Kamal. So today we're going to be focused on the day of surgery. We're talking about the day of bariatric surgery. And most of our procedures are done, as Kamal mentioned, at the American Surgery Center. So we are going to talk about the protocol we have at the American Surgery Center. So a person who's ready to have bariatric surgery will have had a call from the American Surgery Center days ahead to let them know how they need to prepare for the surgery, for the day of surgery when they come to the surgery center. When the person arrives at the surgery center, obviously they will be checking in, but then they will be seen by the nurses for the proper admission. And at that time, they will be given medications that we utilize to prepare the patient for a fairly speedy and safe recovery. For instance, one of the things that traditionally surgeons are used to talk about is that pain medication is given to a patient when the patient has pain, right? You have discomfort, you let your doctor or your caregiver, your nurses know, and you're given pain medication. Well, that used to be the way we did it in the old times. Now we really have a very different view of pain control. We believe that pain control is essential for a speedy recovery, because we want the person to have relatively less pain so that they can be up and about early after surgery. One of the ways for achieving this is actually to preemptively administer some specific pain medications before the surgery. And these pain medications actually will prime the body to have less discomfort after the surgery. So our nurses will actually provide those medications ahead of the surgery. So you haven't had the surgery yet, and yet you will be given medications. But interestingly, these medications are not narcotic medications. These are not the medications that will make the person feel sleepy, that will mess up with the head of the person, that they will slow down the recovery of the digestive tract. These medications do not have any narcotics in them, but they are given preemptively, as I said, and they will make the person much less vulnerable to pain after the surgery. An additional medication that will be given by our nurses before the surgery, again, is a powerful medication that we have available only at the surgery center. Thank you, Kamal. Which allows our patients actually to have less nausea after surgery. Now, as you know, nausea is a fairly common thing that happens after anesthesia. If you've had surgery before, whatever type of surgery, just the anesthetic will have caused some nausea for most people. And then the surgery that we do, the bariatric surgery, which is undertaken on the digestive tract, actually by itself can cause nausea as well. So controlling nausea, controlling this urge to want to be sick is very, very important for, again, a speedy recovery. Well, we have this powerful medication, as I said, that we just have available at the surgery center, that the nurses will be administering to the person, again, before the surgery. So we are working in a preemptive manner. We are preventing, we're minimizing the potential issues from the get-go. Another medication that the patients will have, again, before the surgery, is a medication to minimize the risk of blood clots. As we know, blood clots are one of the potential risk complications of any type of surgery, but also of bariatric surgery as well. The best way to take care of that is to prevent it. And one of the ways we prevent this is by giving this blood thinning medication, which is given, again, ahead of the time by our nurses as the patient is preparing for the surgery. So all these preparations will occur to really influence the recovery of the person, to make the recovery faster for the person. For the person will have less nausea, less discomfort, and also less risk of blood clots afterwards.